Hi everyone, welcome to Center of Balance Live. I'm Phua from Center of Balance, the acupuncturist. Today our topic is diabetes risk factors. Right. Now, the reason we talk about the risk factor of diabetes, this is important, because once you have those things, you need to be careful, because you can avoid it. The diabetes, type 2 diabetes, we may talk about type 2 diabetes, and gestational diabetes, you can avoid it. You can totally avoid it. So not until you realize and you understand what are the risk factors. Otherwise you can't avoid it, right? Now let's talk about type 1 diabetes first. So you're more likely to get type 1 diabetes if you are a child or teenager. So you have a parent or sibling with that condition, or you carry certain genes that are linked to the disease, right? Yes, it makes sense. So you see, type 1 diabetes develop when you're little, right? So you're not born with it. When you're little, you develop it, and which means your pancreas was working well, then it suddenly just or gradually stopped working. So I always have a question about it. Why it was okay and then it stopped working? No one can explain that. Now my master, really suspect that it might cause from what? You probably didn't know about it. It might cause from the injection of what do you call this? Can't remember it. Let me check what you call it. The injection, like all kids need to. Immunization. Yeah, immunization injection. It may cause from that, according to my master. And I do suspect it now. Why is that? Hi Milo. Because just about all kids, they have this problem. And if you search thinktwice.com, and there are many cases talking about the immunization injection, the causing death of baby, causing eyes problem, nerve damage, and organs damage, right? So we suspect that, and maybe that causing pancreas cell damage as well. The pancreas cells stop working because of the immunization injection. So we suspect that as well. Right, that obvious. There's a lot of research on that yet. But we really want to talk about type 2 diabetes, because this is something that you really can avoid it. You can avoid it. And everyone can avoid it. And you can reverse type 2 diabetes, believe it or not. Right. So if you're in Hamilton, in Dinsdale, in Waikato area, this is our phone number: 0784679956. 0784679956. Call us and we can help you to get rid of your type 2 diabetes. Come in for initial examination, and we talk to you. We teach you, we show you what are the solutions that you can do, what can you do at home, what can you do at home, what can you do in our clinic to get rid of your diabetes. I'm saying type 2 diabetes. I have no experience with type 1 diabetes, to be honest, but type 2 diabetes, yes. We help patients to slowly cut down the medication and insulin, and eventually we stop the medication and insulin. Right? Your risk for type 2 diabetes increase if you are overweight. Well, can you change that? Yes. Do exercise, change your diet. That can change your overweight. If you are age 45 or older, yeah, you increase the risk. Why is that? Because the organ start the function decrease. The organs function decrease, then the diabetes chance increase. If you have a parent or sibling with that condition, why is that? Because you guys are on a similar taste or similar diet. So if they get this, then you get this. You high chance to get this, right? And you can avoid that. Change your diet. What they eat, you eat the opposite, right? You aren't physical active. You know, in this stage, we are sitting down and work. You know, all the machines start to work for us. So yes, more active exercise will help you. Why? How did it help you? It helps you losing weight. More exercise help you burn the fat, use up the sugar, so no sugar contained in your body to save into the turn into the fat. Have a gestational diabetes. Now, if you're pregnant and you suffer from diabetes when you're pregnant, and after that you may carry on with diabetes. And yes, we can change that. I have a patient who had diabetes since she pregnant, and after birth, and she still get diabetes, right? Have pre-diabetes. If you suffer from pre-diabetes, then that's another risk as well, right? Have high blood pressure, high cholesterol, and high triglycerides, right? Not very well. Which is the cholesterol, blood pressure. If you have those, how do you change those? Diet. Change your diet is a big part for blood pressure, cholesterol, diabetes. So all those high cholesterol, high blood pressure, high blood sugar, all of them are to do with your diet. Okay, you need to change that. Pregnancy diabetes. So what's pregnancy diabetes? Hi Eric, how are you? Thank you for supporting. Wow. Which is gestational diabetes. So the risk for gestational diabetes increase if you are overweight. Again, overweight, over age of 25. Had gestational diabetes during a past pregnancy. If you're pregnant last time, you suffer from diabetes, and this pregnancy, you have high risk to get diabetes again. But there's no guarantee. You may not get it at all. Have given birth to a baby weighing more than 9 pounds. I'm not sure, but maybe. Have a family history of type 2 diabetes. Why is that? Because your family eating a bad diet and they put on weight, and you put on weight as well. And once you're pregnant, you have the bad habit of your diet, and that's easy causing diabetes while you're pregnant. Have polycystic ovary symptoms. Why is that? Because polycystic ovary symptoms is a same thing, or the same thing is they have insulin resistant. Polycystic ovary symptoms, they have high insulin in the blood, which the insulin can't open the cell to eat the sugar. Then when you're pregnant, that situation remain, so it's easy bring you suffer from diabetes. That's it. So it is wrong to use metformin to treat polycystic ovary symptoms. I never agree with that. I never agree with that. Same as using metformin to treat type 2 diabetes. I really against with that, because I do think with diabetes you need to change your diet, you need to be active, exercise, then you will better. And what diet is the best? I recommend vegan plant-based diet. Some people turn to vegan plant-based diet. They can cut down medication of metformin, or they can cut down insulin slowly with your GP support. You don't do it yourself, then you can really cut it down and eventually stop it. But somebody, when they turn to this diet, they have no confidence, and another part is their organs are weak. The organs are weak. So what do you need to do? We are here to help you to improve the organ function. One organ's function improve with your good diet, the right diet, then you'll be able to cut down your medication and insulin, and you don't need those, and your blood sugar will be better. I'm meaning type 2 diabetes. I'm sorry I don't have experience with type 1 diabetes, but if you happy to come to see us and let us treat you as type 1 diabetes, we're happy to work with you, right? Or you pregnancy diabetes, we're happy to treat you too. So call us 846-7956, 846-7956, 07. So center of balance, the acupuncturist, and I'll see you next time. Bye bye.